Welcome everyone to the replacement for the OT department meeting. My name is Amy Samora and this is Jordan Cabrera, and we have been working on our spinal cord injury program, one of many people involved in it. And I think I want to give you some background. The background is that 2 years ago, if you remember, if you were on rehab and on corp, we brought groups together. We probably did about 3 meetings with all the therapists in those 2 work groups to ask them, what do you think is great about the spinal cord injury program at Harborview? What do you think the program is? And what do you think needs to be improved about it? And so we did that, and we also took all that information and we brought it back to our spinal cord injury leadership. And we talked about what kind of equipment we would need to make this program happen based on the feedback of the group of therapists that did this open forum with us. And then we put together a small task group, and I will warn you, whenever you're asked to be in a task group, know that you're going to be doing a lot of tasks. It's not just a committee. So I think the people that represented the task group from all of the different work groups of acute, inpatient rehab, and corp didn't realize what they were getting into because they did a ton of work for us. So we developed a task group who ended up doing a lot of projects and kind of really streamlining our spinal cord injury program. So I think this is just kind of the result of what they've been working on and kind of an update. It certainly isn't the end to this group. So if you're in the task force, I hate to tell you this, but this isn't the end. It is an ongoing, really trying to improve our process and how we treat our spinal cord injury population at Harborview, kind of throughout the whole continuum of care. So I'm in a weird space. Yeah, if you want to change me. So today's presentation, I want to talk to you about Harborview's spinal cord injury therapy program, our vision and mission. So how we support our patients throughout the continuum of care, so from acute care through inpatient rehab to outpatients. And then really working on how we talk to patients about their goals and about the spinal cord injury program here at Harborview Medical Center. And I'll give you background on that, is that a couple of years, probably when I was on rehab, probably 3 or 4 years ago, somehow the care manager of someone who had been on workman's comp in Alaska and who had been injured in Oregon, it was in an Oregon acute care hospital, somehow they got my number and said, so why should I send my patient to you? Why should you come to your rehab unit? Because I could send them to Craig. I have the money and resources, and they'll be housed there, and they have a great program. But you know, he had family in Seattle, and why would we send him to you? So what if you're in my position going, oh, what would you say if someone said I could send him to a huge rehab hospital in Colorado, or I could send him closer to home to you? What does your spinal cord injury program bring compared to Craig Hospital? What would you say? You can say anything you want, because I'll tell you my answer was not good. I will tell you, you probably have a better answer than I had when I'm like, oh, I don't know.
We have outstanding therapists.
Outstanding therapists, yes.
Good outcomes.
Good outcomes. We have a smaller group of therapists who are highly trained, right, versus 100 therapists who may not be that well trained because there are too many of them, right? I don't know, I could make that up, yeah.
The majority of our care is one-to-one, so we do a lot of groups.
Mm-hmm. Yep.
A lot of one-to-one.
Very individualized care. Mm-hmm.
Very experienced with spinal cord injury. We see a lot of patients.
Mm-hmm.
Percentage of our population.
Yep.
We're one of the model systems.
Mm-hmm. Yep. One of the model systems. I'm supposed to repeat it because you're not on microphone. Sorry. So one of the model systems. Yeah, I mean, I think those are all really good things, and the patient didn't come to us because I didn't sell it. And I think really what I should have said is we have a continuum of care. We have spinal cord injury therapy from acute care to rehab to outpatients, and we have all these therapists really in the therapy group, because she was asking about the therapy program, that are really highly trained because we're small enough to be highly trained, and that we give a lot of one-on-one therapy. But I got overwhelmed by the flash, right? I got overwhelmed by, I'm going to send them to Craig, and they have apartments for families, and they have, they go scuba diving, and I'm just like, oh God. But really what I should have said was that we have this great, amazing continuum of care, and we're going to give you a consistent message throughout. So I think that's one thing I'm going to talk about today, is just how do you talk to patients about their goals and about our spinal cord injury program? How do you kind of manage up our program from acute care to rehab to outpatients? And then really, how do we as a group of therapists provide consistent care? How does someone feel like there is a certain flow to our program, that when you're on acute care, they've kind of started this program for you on rehab, they've continued it, and Corp's kind of helped kind of finish up and kind of brought it to full circle for you. So I think that's really what this presentation's about. We're going to do it in an hour and 15 minutes. Again, next, that was my great. And so the mission of our SCI therapy program is to really provide excellence in the delivery of rehabilitation to patients in the WAMI region. That's really what our responsibility is, right? And our goal is really, this is really what's important about our spinal cord injury program. And I think when we did these big focus groups, this is really what came to fruition, was that our goal was to return patients home successfully and really facilitate regaining active lives to the community. It's really about self-advocacy. It's really about going out to your community and living in the community, and not just living in the spinal cord injury community, right? Not just living at Harborview. Your job is to be out in the community advocating for yourself, knowing that Harborview is here as a resource for you, but that you are there to kind of advocate for yourself. And this really needs to be the message throughout the continuum of care. And really, so this was the vision. This is the vision of this leadership group, which I'll talk a little bit more about as well. Is we need to say what do we do at Harborview? Really, what specifically we do in spinal cord injury, and how do we create an identity for spinal cord injury throughout this continuum with really common goals? How do you engage patients in their rehab? Right? How do you engage someone in rehab and teach them how to problem solve and advocate for themselves really early on, not just when they're done with inpatient rehab going, okay, now you're going to be off on your own at home with some therapy, outpatient, and marginal kind of caregivers, and they don't know a lot about spinal cord injury. So how do you teach them earlier than that, than on the day of discharge or the week before discharge? And really, how do we educate and link our patients to all the resources and community programs to help them further their recovery and also further their wellness? And then how do you develop a positive reputation for excellence as a model systems program in the Seattle area and regionally? And then really, something we need to probably work the hardest is, how do we lead in incorporating advances in research into our program? So this is really the vision of the bigger SCI program here at Harborview Medical Center. So did you know, just so that you know some background about spinal cord injury, is that there was 124 admissions to Harborview last year, and 30% went to rehab. So that means 70% didn't directly go to rehab. So there was a huge gap, right? So just know that not all SCI patients go directly to rehab, and so there's a responsibility of the acute care staff and also the rehab staff and the corp staff to know that we have this gap of 70% of our patients don't come directly to rehab. Next. Also, did you know that we have a robotics program? So we own a ReWalk, right, that's housed over at the University of Washington, which is a robotic system. And this patient, this person on the left-hand side was a former patient of ours. We have a transitions and wellness program that's run here as well, that looks at wellness and strengthening programs and a lot of community recreation activities. And we also host a summit every year. This one's coming up on May 21st at UW, and it's on emerging technology. And if anyone wants to volunteer, email me, because I'll be sending out emails about that as well. And that's usually probably about 100 people come to it, and just get updates on what's new. And this theme is on emerging technology. And then, did you know that, and I got permission, I'm just saying, we all agreed to have their pictures on this. And it was hard to do screenshots on videos, but I feel like I captured them in the moment of activeness, right? Like super active. So did you know that many of our therapists have done hand function presentations at the forum, which are all on video, that you can get off the internet on YouTube, that talked about power mobility, community mobility, and also spasticity. And Geraldine's gonna kill me for that back one. Okay, next one. Let's skip to the next one. And then did you also know that we have therapists that have presented nationally, especially on, Leslie just did one last year at hand preservation. And then also have done poster presentations, and this one was done by Josh and Heather on rehab about the continuum of care from psychiatry to inpatient rehab for Samora spinal cord injury. And then also, do you know, there's Kristen in the corner there, that Kristen Kopeng is the secretary treasurer for the therapy section of the Academy of Spinal Cord Injury Professionals, so they hold national board positions. And then Elisa is part of what's called an empowerment grant that was given to UW Medicine on spinal cord injury and transformation of care stuff. And it was less than a $300,000 grant that goes over 3 years to really work on outreach to our communities, and how do you teach therapists, how do you teach primary care physicians about the care of our spinal cord injury patients that don't live in our area. That's really a bad summary, but that in general is it. And Elisa did a great, if you haven't seen these videos, she did a fabulous video on training for wheelchair mobility. And they're beautiful. I mean, I have to say they're beautifully filmed. They're like a National Geographic. They're beautiful. You have to check them out. Okay, next one. And also, did you know that our therapists participate in every year a spinal cord injury model systems meeting with the therapy supervisors, and they attend these meetings with all these representatives from the therapy supervisor group and do presentations and are able to do some benchmarking, so that we send one of each, one OT, one PT, sometimes plus or minus one. So when we talked to the focus group, we talked about, so what is the strengths of the current program? This was 2 years ago. One is that we have a great interdisciplinary team, including speech, which is very rare in spinal cord injury programs. We also have voc rehab, we have rehab psychology, we have rehab nurses, which is really important. We really look at individualized care. We really look at the whole person and not just what fits into the little pathway that they should go into. We have nationally recognized experts, SCI model systems. We really have resources in treating dual diagnosis, and I have to say we also have great resources, Kathy Kannenberg, for our SCI patients with psychiatric issues as well. I think that's been a great relationship. And really, we have the potential for acute rehab and outpatient therapists to have really this opportunity to work closer together. So what would we think is opportunities? What would we really like to work on? And this came from this focus group 2 years ago. So across the continuum of care, we need consistency of what the patient's functional expectations are, therapy approaches for the patient's own experience, and that our education and handouts are pretty consistent. Right, that the handout that you get in acute care for lower extremity range of motion is going to be consistent with what you get on rehab, consistent with what the outpatient therapists are going to give them, or at least with that same kind of precautions, same kind of theme. And that we want to promote self-advocacy early. So really in the beginning is really trying to talk to your patients about, you know, you're going to need to learn a lot about your injury so that you can advocate for yourself. And there's nothing, it's never too early to do that, and you need to start that really on acute care or any point of entry, because some patients don't go to acute care. Sometimes they end up on rehab from an outside hospital, sometimes they end up on CORP, never going through our inpatient rehab program. So any point of entry, you need to start immediately talking about self-advocacy. And we also need to improve our therapies, the clinical skills of our therapists as well, just to make it really consistent. So when we talk about levels of patient care that the patients go through for therapy, they are in a web of a lot of different things, and they're going to meet a lot of different therapists, they're going to a lot of different, and really what we can control, next slide, is we can really control this. So we can really control the acute care, inpatient rehab, outpatient rehabilitation experience. There are other things, but we just can't, we don't have direct control of it, and I hope in the future we can for more outreach opportunities, but really what we're going to be able to control for now is this experience. So how do you support your patients throughout the continuum of care? So let's watch a video. How do you support them?
Oh my God.
So what's important? Right, communicating, right? So being really able to say, this is really the direction we're in, this is what our program's about. You know, your next level of care is going to be about this. If you have a patient in acute care, being really consistent with saying, this is what's going to happen on inpatient rehab for you. And then on inpatient rehab, this is going to happen on outpatient. And outpatient going, this is what's going to happen when you go to the community, when you're really transitioning to the community and really trying to be out there on your own, you know? So it's really about communication and being pretty consistent with it, right? Because obviously she told her what? She didn't tell her, you're going backwards. You're going forwards. Okay. So how do you provide a consistent message? Well, if we just told you what to say, but you can't read off a little card and say, this is what you have to say. You really want to have major talking points. And so for our overall program, what we talked about is just being, it's important to be well, it's important to advocate for yourself. So these are kind of talking points that we came up with when we talk about what our therapy program is about. And this is important to say, is like maintaining and even improving your health is important because it's going to decrease complications and it's going to allow you to improve your function. And that's research-based, like that's true. And I think people don't understand that you can be healthier, more healthier than you thought you could be, and probably healthier lifestyle than you had before you were injured. I certainly have had patients that look so much more healthier after a couple years in their spinal cord injury than they show me pictures before of kind of the lifestyle that they had, right? So you can live a healthier lifestyle. Spinal cord injury doesn't stop you from being healthier. And then also we're here, so our role in rehabilitation is that it is important that you be healthy and active as possible, and not just physically healthy, but emotionally healthy, whatever you need to do to be healthy and to be as active as possible. And another thing to tell people is that we can't predict your future, right? Because what do they always ask you? Am I going to walk again? Usually it's walking, right? Am I going to walk again? Am I going to be able to go back to work? And really, we can't predict your future, but we do know that people with spinal cord injuries who maintain healthy lifestyles have much better outcomes. And that it's really important that they educate themselves, but they need to educate themselves not from Wikipedia, but from well-known, reliable sources. And hopefully it'll be through us and through our website as well. And then just realize that, because what else do they say? Oh, my friends, cousins, nephews, whatever, came by and he had a spinal cord injury 20 years ago and he's walking and not having any problems. And it's important to tell people that not every person with a spinal cord injury really has the same outcome. So for acute care therapists, what do you tell your patients when you're talking about what your role is and what you guys do for people? When you talk to them about what you do.
First, just start off with what to expect that day.
Mm-hmm.
We're going to help you sit at the edge of the bed if it's a reasonable goal.
Mm-hmm. Yep.
Just baby steps.
Mm-hmm. Yep, especially in the beginning, mm-hmm. right? Sometimes they don't have their diagnosis, right? Even at that point. Yep. And then anybody else from acute care, kind of any hints on what you tell people when you first start seeing them and they're realizing that their legs aren't moving or their arms aren't moving and you're having them do some things that are really challenging?
Especially saying something about just trying to have them be as independent as possible.
Yep, trying to be as independent as possible.
Yeah, that there's different ways to be independent. Start talking about skin integrity and
Mm-hmm.
Protecting their joints and everything like that.
Yep. So trying to be as independent as possible, really preventing complications, really in that first rollout. And so yeah, those are great things to say, and we just kind of summarize what you guys said, is that really it's important that people know that when they're in acute care that their rehabilitation's already begun, because sometimes they'll say, well, I'm going to wait till I get to rehab and then I'm really going to be focused on stuff, right? But really it's really begun, and really your first phase is really improving endurance, improving you learning more about your injury, really preventing complications, and really it's important that they take advantage of the opportunity to be at a spinal cord injury program, especially when it comes to people not being able to participate very well. It's really important that they realize that they're at a really amazing spinal cord injury program and they need to make the most of this time that they have with us, that this is really kind of the time to focus on themselves. And really another thing, which is I think good advice to tell people in preparation for their next level of care, is really have a daily activity goal. Like every day, you need to get out of bed every day. You really do, unless they tell you absolutely can't, but you really need to get out of bed every day and do the exercises that the therapist have asked you to do. Like at the very minimum, this is the expected activity. There should never be an excuse to not get up out of bed. And really be curious about your care when people are doing things. Ask them, why are you doing this if they haven't explained it to you? Or if they're doing it differently, why are we doing it this way? And sometimes they'll say, well, it's fine to have the variety, but in other cases, no, we kind of need to stick with the program. And really it's important that you advocate for yourself and to really kind of take over directing your care as you gain more knowledge. So first learn about your injury more and then be able to gain more knowledge about it. So what about from inpatient to outpatient? So when you're an inpatient therapist, what do you tell them when they land on the unit, what you're going to be working on?
First of all, tell them it's the next phase of an ongoing process.
Mm-hmm. Yep. And then when they're going to outpatients, what do you kind of prepare them for? Because here they're used to 3 hours a day of therapy, right? 5 times, 6 times a week, and now they're going home or to somewhere else, skilled nursing facility, adult family home, and so their therapy is going to be a different focus, right? So what do you how do you explain that to them?
They need to be more responsible with taking on exercises or things that we give them in preparation for going to court for outpatient
Yep.
or SNF or whatever.
Yep. Yeah. Any inpatient rehab therapist? It's a hard conversation going from inpatient rehab to outpatient or home health, to really kind of talk to them about, we're going from 24/7 spinal cord injury nursing, spinal cord injury therapist with you every day, even though we give you opportunities to be independent, to going home where setups are not right and caregivers that you have to direct all the time. Like, it is a hard transition, and I think that's definitely a work in progress for our group to work on, is how do we get that transition, because I think that's one of the hardest transitions to make. There is definitely a dip in people's activity level when it comes to that. So we talked about it in our task force and also with our leadership group, is that it's important that you are actively involved. And really, when you're done with inpatient rehab, it just means you've graduated. You're ready for the next phase of care. You're ready to kind of live your life. And the therapists there are just kind of helping you along with these new goals and any complications that might be occurring during that transition home, that really you're ready to do. And I think that's something we need to prime our patients for in inpatient rehab, is that you're ready to go. Right now, you need to do your life, and then we have outpatient therapy to support you as you kind of transition to that life. We need better ways of talking about it. That's a really hard transition. And really advocate for yourself, and really be in charge. And then outpatient, the community, so outpatient therapists, how do you discharge your patients, or how do you transition them to where there isn't therapy? What do you tell them? What do you tell them?
I think we like to help them kind of highlight the skills that they have developed
Mm-hmm.
in preparation for ongoing self-advocacy
Mm-hmm.
that they need to be able to do out
Yep.
there. And what have they been doing during the course of transitioning back home?
Right.
For them to really look into the community for resources and
Mm-hmm.
see what they have available to them.
Mm-hmm. And I think that's an important conversation to continue to have from inpatient rehab onto outpatients, right? Because now it's like you need to really look at community resources as we transition you home, as we transition you now from outpatients to the community on your own. Next. So talking to the patients about their injury. I'm going to hand this over to Jordan. Sorry.
All right. So how do we talk to our patients about their spinal cord injury? So we all know this is a difficult conversation for many reasons. Often, patients may have unrealistic expectations. They may not really understand their injury or have accepted their injury. They may also not agree with your therapy approach, for example. So there's a lot of different ways. And so before we delve into this, let's practice, or let's actually think about a specific patient. So in your mind, just think about a 21-year-old male with a C5 complete spinal cord injury from a snowboarding accident. So this is your second day working with the patient, and they just found out yesterday from the doctor that they have a spinal cord injury, or they have a complete spinal cord injury. So you want to talk about their goals. And so how would you begin this conversation?
I would just ask them what they remember from talking to the doctor. Like, what do you know about your injury? Because before I give them anything, I want to know what they understand about it, so they're not totally shocked or surprised.
Yeah.
That teach back moment, I guess, would be the word.
Yep.
You want to also just acknowledge that they're probably feeling pretty overwhelmed.
Mm-hmm.
A lot of information coming at them.
Yeah,
Really
definitely.
just recognize that.
Definitely, yeah. Would you right off the bat talk about functional expectations of a C5 SCI on the second day? Yeah, probably not, no. Would you discuss like their priorities, their interests in their life? Maybe, yeah. Okay, go ahead. So now we're gonna, before we talk about this, we're gonna talk about some psychological perspectives. The slides I'm gonna talk about actually came from two resources. One resource was from a talk done by Dr. Charles Bombardier, and a lot of us know him. He's a psychologist here at Harborview. He does a lot of research in spinal cord injury and depression. And he gave a talk during the SCI forums. And Amy talked a little bit about that. So that's the meetings that are run by the SCI model systems, and it's about different topics about spinal cord injury that's given to patients and clinicians and caregivers in our community. And so he spoke about bouncing back from depression after spinal cord injury. So I got some information from that. And another source was from Dr. Josh Dyer, and you all also know him. He came to talk to our SCI task group, and he spoke to us about just some tidbits on goal setting and other psychological perspectives. So to start, let's just talk about what depression is and anxiety. We all know what it is. We know depression is a mood disorder that can be, is not just sadness. It can, it can be, it's a mood disorder that where patients experience like lack of pleasure in daily things. They might have sleep issues, lack of energy, may have feelings of worthlessness and guilt, maybe thoughts of suicide. And a lot of us know what anxiety is. Anxiety is an emotion characterized by worried thoughts, the tension, and often manifests as physical changes. And so we all know this happens after spinal cord injury, but do you think it's pretty common? Okay. So in your head, what percentage of patients with SCI do you think are not depressed or anxious?
60.
Are not depressed? Okay. Small, okay. Okay, so,
There's more.
Yeah, so based on a study done by Dr. Bombardier, he found, and this is a pretty recent study, so it was, it's actually just in print right now, or just being published right now. And then so he found that 64% of individuals with spinal cord injury are considered resilient, meaning that they're not depressed or not anxious. And he actually, in the talk, he talked about other papers that found similar results. And so it's pretty surprising because often we automatically think our patients are depressed or anxious. And so we know that this isn't always the case. And so often depression came before the spinal cord injury. And then we know there's a lot of different causes or risk factors for depression. So for example, if someone has a pre-injury history of depression, then they're 24 times more likely to be depressed. If they have a patient has lower income and lower education, they're twice as likely to be depressed. Other risk factors include if they have chronic pain, if they're less active, if they have a pre-injury history of substance abuse that increases their risk of being depressed. So we have to remember that all our patients are not depressed. We can't automatically think that. So it's really important to talk about how we cope, how we help our patients cope with this. And so Dr. Bombardier talked about ways to bounce back from depression. And so some of the highlights were, he talked about discussing with our patients and the team about antidepressant medications, physical activity and exercise. So as therapists, we play a big part in that. Improving pain control, talking to the team, to the doctors about medications that are needed or exercises, stretches that we need to do with our patients. And also they say that sometimes treating pain may help reduce depression and vice versa, helping treat depression treats chronic pain. So we all know there's a link there. And also a big part is also just counseling and trying to help our patients change their way of thinking of their SCI. In the psych research, they talked about how there's patients who think of their spinal cord injury as a threat versus a challenge, and so some patients may think of their SCI as a threat that they succumb to versus a challenge that they can cope with, and so. Patients who think of their SCI as a threat have poor quality of life and more depression, and people who think of their SCI as a challenge have better quality of life and less depression. So some examples of some thinking traps that Dr. Bombardier talked about is, when patients think of it, they may say, my body doesn't work anymore. But really, as clinicians, we want to really encourage them to, instead of not thinking that, having them think, I have so much to do to take care of myself. So we can say that really changes the way they think about their SCI and puts them into a role where they can change something. Another example is they may say, there's nothing I can do to change the situation. But instead, we want to instill this fighting spirit in them and really have them say, I'm going to find ways to make my life easier or better. Another example is if patients view themselves as dependent, they may say, I can't do anything for myself, but instead we want them to think of them as interdependent and really a part of the team. So we want them to think, I need to learn how to work with caregivers better, for example. So there's a lot of different ways that you can help phrase their situation. Yep. There you go. Dr. Dyer also talked about some advice about goal setting. And so he talked about how there's two factors in talking about goals with our patients. So one is importance of the goal to the person, and the other one is the confidence of that the person can achieve that goal. And so if you have the patient rate their goal, each goal from 0 to 10 on a scale, so 10 obviously being better, for importance to them and in confidence that they can achieve the goal, if the patient rates the goal greater than 7 for importance and for confidence, they actually have there's a higher likelihood of them achieving that goal. So there are a lot of ways that you can help build motivation around goal setting. I know we're not the primary people who may help motivate patients, but we play a big role in it with the psychologists. But if you do talk to your patients and you want to motivate certain goals for them, you want them to think about the goals in positive ways. So you can ask, let's say there's a transfer goal. Let's say your goal for them is to have them transfer from independently out of bed. So, and when you discuss that, if they measure it as like a 5 out of 10, you may want to ask them, so why is it not a 4? Or why is it not less than a 4? So then that makes them talk about, well, the positive aspects of it. So, they might say, well, I need to get out of bed, or I need to get into my wheelchair, I need to be independent. So you want them just to think about everything in positive ways. Also, if you want to kind of strategize and find ways to help the patient make it more achievable, you might ask, so what can we do to make that goal more than a 7? So then, for example, if back to the transfer goal, if they say, well, I have a lot of back pain, so you can say, well, how can we make that, how can we strategize to address that issue? So then you could talk about, talking to the doctor about medications, talking about stretches or exercises that may help. So you always want to, and you also always want to consider the goal, like to make sure it's something you want to build up. So obviously, if it's not a realistic goal, then you wouldn't want to build up that goal. So yeah. And also, you want to make sure you're considering the patient when you're talking about goals. You want to ask them, what are your goals? What are your goals? Instead of saying, these are my goals for you. You want to use more of their words instead of medical jargon. And what I thought was interesting is that Dr. Dyer said inpatient rehab is really the best form of an antidepressant. And in inpatient rehab, you have all the components that are needed to to treat depression. So that is having achievable goals. We all know all the therapists, they have tons of goals during rehab. Exercising, so of course the therapists, we all love exercise. The patients are having a set schedule, and then they're participating in social interaction. So as our patients transition out of inpatient rehab and into outpatient and into the community, we want to make sure that we are helping them find resources and setting up their new environments with these components in mind. So to help with this conversation, one of the things that the SCI task group developed is the patient passport. And so what it is, and then you guys all have printed handouts for this. It's an intake form that is used to help you have this conversation with your patient. So it's like an intake form, and it should be completed after the person gets their diagnosis of a spinal cord injury from their medical team. And it can be done in any part of the entry into the HRBB program. So either through acute care, rehab, or corp. So what it does, you can see it prompts you to kind of talk about, how did they spend their time before their injury, and so it asks about family, travel, sports, recreation, all that stuff. And then among those things you talked about, what are your top priorities? So then you can really understand the patient and their situation and really help make a more patient-centered plan of care. So let's practice this. So I'm gonna have you guys all pair up, and one person be a patient, one person be a therapist, and then we'll just have you practice for a few minutes using the passport. So. Everyone? Okay. All right, guys, we're gonna start again. Okay. So how did you guys all, what do you guys think about the passport? Does it help at all, like prompt the conversation? Yeah? Okay.
Usually, what would you say? You would say, this is what I do as an OT or a PT or as a nurse or whatever, and this is what I do, so what would you want to do as a goal with me? What's the normal response? I don't know. Yeah. If you're a PT, what do you get normally? Yeah. And that dead ends your conversation, right? Because you're just like, and you actually don't want to talk about it because you're like, I don't want to be the one to talk about it, Yeah. But I think this gives you an outlet to talk about activities and what's really enjoyable and what's really important for you, and to just kind of let that person have this process with you. And I think that's the most important thing about this conversation we're having today is about you should not feel responsible as the only person treating this person as their spinal cord injury. Like you are part of the process, and if you can't get to where you need to go with that person, you can hope that the next level of care is going to be to kind of carry on, because not everyone's going to recover at the same pace. I mean, I've certainly had people really still believe that they were going to walk 10 years after their injury and not really get over it, but eventually they do, and there's other people that kind of get it after a couple weeks. And so just know that you don't feel that burden of taking on this care by yourself, that somewhere in our continuum, someone's going to get to this person and be able to be successful with them. And you're just kind of planting seeds along the way for them.
Yeah.
I like the drawing out part of the patient.
Mm-hmm.
Because then we can really start to focus on the steps that they could start with to get to their goals.
Mm-hmm. Yeah.
Yep. Okay. So what if the patient said, the doctor told me that 99% of people with my injury will never walk again. I want to be that 1%.
Paradox saying, I appreciate your determination and your interest in working hard, and we're going to start with the first steps we need to do to improve what you got right now.
Yep. Yeah, definitely. It's a good way to say it.
Anybody else? Words of wisdom, especially for people that are new therapists and have to deal with someone who's saying, I want to be that 1%.
I've been told by returning patients to not take away their hope, even if we don't believe that will happen for them, because it can be a crushing blow, but not to set them up for unrealistic outcome possibilities either.
Yeah.
I think
Definitely.
it's difficult too, because you want to maximize, especially in inpatient rehab, the time that they have there working on things that they need to work on. But doing that while not kind of crushing what their hopes are for their future is a challenge.
Mm-hmm. Yeah.
I also think it's nice to acknowledge that you would want that I like to say, like, I would love that for you. Like, that's so, like, yeah, I want that for you too. Let's work on what it would take, to support you in that.
Yeah.
So I think just acknowledging that you not only like hear what they're saying, but you support them in wanting to be the 1%.
Exactly.
I think you can do that without saying that you believe they will or will not be that 1%.
Because what happens when you say, well, according to statistics, you probably won't, and we need to get you your power chair, and we need to get all these things done before you leave. Like, what happens to that relationship between you and this patient? It kind of goes, and where do they go instead? They go to the internet, they go to different rehabilitation, they go to activity-based rehabilitation programs, they go to someone who's gonna give them the support
What they want to hear, yeah.
What they want to hear, and my choice is I feel like we need to provide them with support and also provide them with the right education. To be really we're part of your journey with you. We have a great continuum of care, and we're just going to keep working with you on this and support you through it.
And sometimes when they come down off of that, then they need counseling for adjustment to disability,
Right.
because now the enormity of their weight of their disability is really falling.
Yeah. And it can happen, I'm sure you can attest to this, it can happen at any stage.
Right.
Any part, it can happen in a couple weeks, it can happen years out. Right.
Mm-hmm. Go ahead. So so this brings us back to what Amy talked about, our shared vision. So just like Leslie, when you're saying that you're supporting them, we definitely want to show them that we're on their side. So we're not there to discourage them or think otherwise. We want to show them that we are all on the same page, and we want them to be that 1%. Go ahead. And so this is really important because we want them to make sure that they know that we're part of their team, but they need to be the biggest player in that team. So, but we want them to be as healthy as possible to be that 1%. So, but how do we do that? So that's, it's easier said than done. So, on the backside of the Passport, there's the components of the program, and this was also developed by the SCI task force. And what it is, it talked about us as a SCI center, and also in patient language, it talks about each component of what we have to offer them, each component of our program. So this is a great way to have that conversation what our role is in the rehab, so that we are there to help them, and we have a lot to offer them. So there's it's a pretty long list. So we have check marks. So it's really hard to sit through this whole thing in one setting. So you can use the check marks to kind of piece it out, and so you can really have a good discussion about what we can do for them as an SCI program. So another thing that we did in the SCI task force is we really wanted to make sure that we're providing consistent care throughout the continuum. And so we looked at the patient education handouts that we had. We all know there's tons of SCI handouts from all the work groups that's been developed by different students and different therapists and different organizations. And so there's a lot out there. A lot of them are on the server, but who gets lost on the server? Yeah. So what we did is, there's representatives from all the work groups in the task force. So we all try to collect all of them, and then we look through every single one, and then we try to we found ones that we liked that were better or more concise or more comprehensive, depending on what we wanted. And we also updated a lot of the handouts with new pictures and new language. And so we posted them on the intranet, thanks to Joanna Brown. So she helped us do that. This is how the intranet looks like. Actually, it's also here too. I opened it here. So it's under the patient education link, right, under clinical, and there's a SCI page, and then so this is just our initial initial batch of them. Our task group is going to meet again and upload all of them, the rest of the topics. But there, right now we have these handouts that we talked about, like the passport and the components descriptions. We also have, right now we have a section on education, on exercises and range of motion, skin, bowel and bladder. And you can see how a lot of the handouts have, they're organized based on levels. So there's a basic, intermediate, and advanced level. And so, as clinicians, you guys can decide how you want to use it, based on patient, their education level or their language level, or just where they are in their rehab. Because, as you know, a lot of times, patients may not need to know everything about skin, for example. Like they may not need to know all the pressure, the stages of pressure sores, or all this stuff in the beginning, but they may just need to know how to do a pressure relief, for example. So there's a lot of, so there's different levels that you can use based on the patient. And go ahead. We'll go back.
Don't make me do it.
Oh, oops, sorry. I messed up. From current slide. Oh, sorry. You see that. And so we also,
Goes to the video again.
sorry. There we go. And we also, the SCI task group also developed an introductory handout. So this is a one-page front and back introductory handout about spinal cord injury. So it just talks, it's pretty basic. So if you want to have something really easy to talk to your patients about, that's really concise and talks about a lot of different topics in one page. This is one that you can use as well, and that's on the internet. And so not only do we want to help improve our patient education handouts, we also want to improve our clinician training. So we're in the process of developing a clinician training program we're calling it the SCI Boot Camp. And it's going to be for us so we can all be on the same page. Again, this is still, we're still discussing this, but the goal of it is to be, is to have like 5 hands-on modules that we're going to try to develop with the SCI task group, and it's going to be taught by the SCI task group about a lot of different topics. So having a medical module, which will be more of a self-study, but also one on upper extremity preservation and splinting, balance, like preparatory skills and pressure relief, mobility skills, and wheelchairs. And so we're kind of envisioning having an hour and a half modules on this, and then having people come based on their work group needs, and also providing some continuing education opportunity as well. And so we also developed these clinician guidelines that will roll out with the boot camp, and they're just the task group developed. They're kind of like standards of care that talked about all the components that we want each therapist to do with their patients, so we all are kind of consistent in doing the same thing, and we'll roll this out with the boot camp. So in summary, so today we talked a little bit about our mission and vision for our SCI program, how we maintain our current message throughout the continuum of care, and how we can better talk to our patients and have a better approach about their rehab. And so I know there's a lot of information, and as we said, this is still in the process, but there's a lot of things that we want you guys to do right now to start. And so we really want you guys to, starting today, hopefully, really start considering the patient. And I know a lot of you guys are doing that, but hopefully using the handouts to help you with that. Really utilizing the patient education handouts on the internet, because most of them are there for now. And then really talking about to your patients the next phase of rehab, so really helping prepare them for what they're going to be going through for the next phase. Definitely give us feedback on the new handouts and on these handouts as well, on the education handouts and on these handouts, and let us know if there's things that you notice or you want to change. And really, feel free to ask help from any of the SCI experts. They're all over, on all of the different work groups. So definitely ask for help when you need it.
Yeah, and I think it's really important to This presentation's a little different than the first one that came out because we really did utilize the feedback that was given to us from the first one we did. And then, so it's important that you just give us feedback, like even sending a handout to us and going, this is way too dark, or the angle of this is weird, or I think it should be better worded, because really this is continuing to be an ongoing process, and it should always be an ongoing process to be better at what we're doing. Okay, we're not done though, by the way. Sorry. Oh, I'm going in there.
Thank you. And so this is where, these are all the members of the SCI task force and the leadership group that really worked really hard to these past few years to make all these updates happen. A lot of them are here in this room, so thank you to everyone. Yeah.
And I think in the future it really is to really expand it to other parts of our team as well. We needed to stay pretty focused on our group because it was really, it seems like, God, that just seems so intuitive and we should be all doing it, but it took us 2 years to get to this point with a lot of meetings in between. And it's a different concept on how we approach our patients.